Dural chain activation technique. So this is one of the technique which is used in our clinic. This helps in decreasing your anxiety and in regulating the flow of the fluid, which is CSF, that is the cerebrospinal fluid. Now this fluid, it runs from your brain till your tailbone, and through after the tailbone, then it goes through the nerves till your great toe. So many a times what is seen is we sit for longer periods, we are in a certain posture for longer periods, maybe standing, and we hold emotions at various levels in our body. Now with this holding, that a covering which extends from the brain till your great toe, that is the dura mater, it gets tightened up. It's the same covering. There are various layers of covering on our brain, and the dura mater, it extends down till your great toe. So that dura mater gets tightened up. It is the extension of the fascia. Fascia is a thin polythene in which our body is completely wrapped. So this is highly sensitized to emotions and it gets tightened up. So what happens when it is tight? You will have blocks at various level, and even if you are doing maximum amount of exercises, flexibility, you will have a block at that level. Means you suppose I'll just give example, you're bending forward, so you will be bending more from the hip and not from the spine because of the block. So compensatory pattern will get developed in your body. So now in this DCAT technique, what exactly we do is we mobilize the fascia from head to toe. So everything is fascia in our body. The skull bones, so there is very little amount of pulsating movement, and because of the tightness or because of the stress or any type of injury, that movement gets restricted. So once that movement is restricted, what will happen? Complete kinetic chain will be tightened up. Okay, so suppose this bone, frontal bone, is tightened up, he will have issues in the front side of the body. If the temporals are bones are stuck, the patient will have issues only on the one side of the body. Okay, if the occiput, the back side of the skull, that bone is stuck, the patient will have issues from head to heel, from the back side of the body. So these bones, we mobilize those, we bring them back their mobility. Okay, so to begin with, like, it is very simple, no movement is there, just we assist the normal pulsating movement, that's it. So suppose now I'll just show you the frontal lift technique. There are various technique, almost for an hour this technique goes on, and many times it is seen that the patient falls asleep and for hours together. And this is a technique where we just reset our brain. So because of the wrong thoughts, because of the wrong pattern of thinking constantly we are into, so all those adds up to the stress in the body. Okay, so with this technique, the body is reset to a new level where your parasympathetic, that is the calming system of your body, will get activated, and the sympathetic, that is the fight flight mode, that will gradually reduce. Okay, so this is a very good technique, and I think everyone should go and take this technique. So I'm just showing one technique here. This is the frontal lift technique. So I'll be just placing my hands and I'll be just lifting this bone. So there's very minimum movement, less than I think 0.5 millimeter, but then like the sutures over here, the bone gets stuck. So with this lifting technique, this will get released and maximum flow of the CSF will happen over this area. And the another technique is the parietal lifting technique. So here I will be just lifting the side bones, the parietal bones. So these are like I'll be holding till that rhythm gets normalized. So it differs from patient to patient. Some patient might have a stuck frontal bone, some patient might have a stuck occipital bone. So So it depends. Now for the occiput, it's a very easy technique. I'll be just cupping the back side of your head and I'll be just mobilizing that. So very less movement. So we have to just assess that movement, and many a times what is seen is these movements, they are sometime this way. Ideally they should be like this. If I am doing for the back, the occipital bone, the movement should be like this, very smooth, same on both sides. But maximum time it is seen that it's abnormal, and in each and every patient, I'll tell you 99.99% cases this temporal bone is disturbed. Now the reason there we can't say, but there are many reasons. Now how we can balance that temporal, just have a look. So his temporal, one more video I had shown the temporal bone management. So that movement is like this, and the temporal bone should move like this. So we will be balancing it, and the patient will not experience any type of pressure. It is just 1 gram of pressure which I will be applying. So no pressure, no forceful, no cracking, nothing. So this is a very good technique where we will mobilize all the fascia from head to toe. Okay, the fascia in our brain is the flux cerebri. We start from here and till the plantar fascia. So everything is mobilized in this. So this was just a few technique where I was mobilizing his this thing, skull bones. The next technique here, what we do is we treat all the diaphragms. So what are the diaphragms? Diaphragm, they are the divisions. Diaphragm, they are the divisions. Okay, where one area is separated from the other. But then what is the function of this diaphragm? Diaphragm helps in upward movement of the lymph. So we have various, we only know there is one diaphragm, that is the thoracic, that helps in breathing. But we have various diaphragm at every level. We have the ankle diaphragm, we have the knee diaphragm, we have the pelvic floor diaphragm, we have the thoracic diaphragm, we have the this thing inlet diaphragm, thoracic inlet. Then we have diaphragm at the hyoid bone, at the jaw bone. So we what happened with stress or some other activity, that all diaphragms are stuck. So we mobilize those diaphragms. So I'll just show you a few of the diaphragm. So this the thoracic diaphragm, and right, and I'll be just placing my hand with 1 gram of pressure, and I'll be just first observing how the movements are there. So now his movements are on the posterior side, back side there is no movement at all, and in the front it's up and down. How ideal it should be? It should be this way, anterior posterior. But then in his case this is not moving and this is like upward movement. So now when this pump, that is the diaphragm, if it is moving in a wrong way, what will happen? Full rhythm in his body will get disturbed, because this is the central diaphragm. So when that central diaphragm is not moving properly, his pelvic floor diaphragm will not move. Then he'll have issues with his low back pain. Okay, when his pelvic floor diaphragm is not moving, the knee diaphragm will get stuck to assist this. So then he might have knee pain. Okay, then if the ankles, if this diaphragm remains stuck for longer period, then his plantar fascia will get tightened up. So everything in the body is linked. So even if that patient has like a long time head injury, maybe in the childhood, every child falls down and that bone got stuck, one bone got stuck. So as the child develops, he will have little headaches, little pain on one side, and then gradually as he turns into adult, that time he might develop migraine or some sort of constant things. So these blocks that gets removed with DCAT, and your body is reset to a new level where your brain will be very calm because of the constant circulation of the CSF, And once the nurturing and nutrition happens to the fascia, to the brain, and each and every aspect of the body, definitely our body will be vibrating at a higher level. Thank you.